The triangular fibrocartilage complex, or TFCC, is a structure made of cartilage and ligaments which helps to support the side of the wrist. How is it injured? TFCC injuries may be from repetitive overuse or from an acute injury, usually a fall or a twisting injury. The result? Wrist pain on the little finger side of your wrist, especially during twisting and gripping activities, or when leaning on your hand. The wrist is complex. There are many possible causes of pain on the same side of the wrist as the TFCC. If you have pain in your wrist after a fall or sudden twisting injury, please see your physio or doctor to have it assessed. If you have severe or persistent wrist pain from repetitive activity, see your physio or doctor. You can get some idea if your TFCC is a problem by the exact location of the pain. Some or all of these movements are likely to be sore if you have a TFCC injury. Taking weight on your hand, lifting in a palm up position, gripping and twisting, pressing on your hand while standing up from a chair, and moving your wrist toward the little finger side. No single test will pick up all TFCC injuries, but this is a useful tool to give you some idea. Your fingers provide stabilization for the patient's ulna, while your thumb adds pressure through the heel of their hand. This stress test can be applied with the patient's arm in various positions to check for TFCC injury. Most TFCC injuries can be diagnosed in the clinic without any medical imaging. The TFCC does not show up on X-rays, so if imaging is needed, an MRI is the best scan. The big idea when it comes to treating TFCC injuries is very simple. First, you get the pain and inflammation to settle down. Then you gradually rebuild the movement, strength, and function of the injured wrist. There are many options to help settle down a mild TFCC problem. The first key is to identify and then modify or avoid aggravating activities. In the early stages, use standard RICE strategies: rest, ice, compression, and elevation to decrease the inflammation. If medically appropriate, you may benefit from using non-steroid or anti-inflammatory medications. And your physiotherapist can help tape your wrist or can provide you with a wrist widget support. Some TFCC injuries are very painful and need more support and protection to enable them to settle. It may be enough to get an off-the-shelf wrist brace from your local physio or a pharmacy. A custom-fitted thermoplastic splint offers even more support and is great for the majority of severe TFCC injuries. In rare cases, even with the wrist splint on, pain continues during twisting movements, turning the palm up and down. In these cases, a hand therapist can fit you with an extended splint, sometimes called a sugar tong splint. The building up process is best guided by your physiotherapist in all but the simplest cases. It will involve gradually decreasing your dependence on splints or taping, gradually strengthening and desensitizing your wrist to pressure, and gradually returning to aggravating activities including work and sport. In some cases, TFCC injuries fail to respond as expected to this treatment plan. If it's not possible to settle it down, or if the rebuilding program keeps failing, it may be appropriate to have MRI imaging, or to seek referral to an upper limb surgeon for an opinion. We hope this has been a useful introduction to the TFCC. If you think you have a TFCC injury, please contact us at Flex Physiotherapy, or search online for a reputable hand therapy provider near you.